Hello, everyone, and welcome. My name is Dr. Piri Ackerman-Barger, and I'm your MC for the day. Before we get started, I want to go over a few housekeeping items. If your screen freezes or you lose your audio, please refresh your browser and be sure to log in via the Chrome Internet browser for optimal viewing experience. Closing any other operating programs, windows, may help you with your viewing experience as well. Please feel free to use the chat feature for any questions or comments you have during our forum, and we'll do our best to respond to you. Please include your email address when you post a question. That way, if we don't get to respond to you today, we can follow up with you. This program is being recorded, and you'll be able to access it on the Campaign for Action's website within the next week. Please be sure to check out our resources, which you can access through the toolbar found at the bottom of the Intrado platform. Joining me today are my friend and colleague, Dr. Winifred Quinn. Welcome, Win.
Thank you, Piri, and thank you for joining us again as our MC. For our audience members who are not familiar with Dr. Ackerman-Barger, she is the Associate Dean of Health Equity, Diversity, and Inclusion, as well as an Associate Clinical Professor at the University of California, Davis, Betty Irene Moore School of Nursing. Piri also serves as an advisor on equity, diversity, and inclusion for us here at the Campaign for Action and the Center to Champion Nursing in America. And hello to all of you who have joined us for today's Health Equity Action Forum, where we will discuss nursing as a career to achieve financial security. This is the second in our series of 3 Health Equity Action Forums. We purposely scheduled our second forum days to honor Black History Month, and we thank our AARP colleagues from Multicultural Leadership for that suggestion. At our first event, we had a robust conversation on the value of a diverse nursing workforce to achieve health equity. For those of you who missed it, we do encourage you to go to our website, campaignforaction.org, and view the recording and access resources we have provided for the series. Also on our site, you will find information for our third and final event, slated for March 30th. During that forum, we will focus on nurses serving individuals, families, and communities. This set of forums is sponsored by the Future of Nursing Campaign for Action, an initiative of AARP Foundation, AARP, and the Robert Wood Johnson Foundation. And we are partnering with AARP's Multicultural Leadership and Global Thought Leadership teams, led by our dear colleagues, Edna Kane-Williams and Dr. Jean Axios. Together, we are pleased to host today's event, Nursing as a Career to Achieve Financial Security. So when we use the term health equity, what do we mean? The Robert Wood Johnson Foundation defines health equity as everyone having a fair and just opportunity to be as healthy and well as possible. The Robert Wood Johnson Foundation goes on to say that this requires removing obstacles to health, such as poverty, discrimination, and their consequences, including powerlessness and a lack of access to good jobs with fair pay, quality education and housing, safe environments, and healthcare. For more than 10 years, the campaign has been committed to ensuring that the nation's 4 million nurses are key to improving health equity and to creating communities in which everyone has access to high-quality care. We strive for a nursing workforce that reflects the diversity of the nation's population. Increasing the numbers of diverse nurses from different backgrounds, including race, ethnicity, gender, and sexual orientation, will contribute to better health and healthcare for all. From such diversity in nursing comes a deeper understanding of the elements that affect a person's health and emotional well-being, and ultimately improved care and treatment. There is much for all of us to do in this nation to achieve health equity, many actions to take, and many that we can take together. One action is to ensure that the clinical workforce and leadership reflects the population of the United States and each community being served. And of course, this includes nursing. During our first forum last month, we shared some data, and I encourage all of you to go to our website, listen to the January 12th program for those details. In summary, between 2008 and 2018, according to the HRSA's data, There has been a very significant upward trend in more Hispanic Latino nurses and a good upward trend of more African American nurses. Unfortunately, the census for the Asian American nurses has dipped a bit, and our Native American nursing numbers remain very low. That summary was for nurses in the overall workforce. However, the numbers of racially and ethnically diverse nurses in leadership roles, both in academia and in practice settings, are really low, appallingly low. We have a long way to go before the makeup of the nursing workforce and leadership reflects the population of the United States. And we at the campaign and AARP remain committed to help achieve that goal. We invite you to track our progress by going to the website campaignforaction.org and sign up for our newsletter, the campaign update. It's an electronic newsletter. Please also use our website if you would like to be more involved with us and would like to work with us on achieving health equity through diversity in nursing, and we encourage you to do that. Turning to today, we are addressing an important topic. We are discussing how nursing is a good career for historically underrepresented and underserved individuals because it helps achieve both health equity and financial security. We will also explore tools and public policy options to get more people from historically marginalized communities into nursing careers and to advance within the nursing profession. We will hear from financial experts as well as several nurses and nursing experts who will share their stories and lessons that we could all learn from. And now I am delighted to introduce my dear friend and colleague, Dr. Jean Axius, Senior Vice President of AARP Global Thought Leadership. Jean will briefly explain what his team does and why they focus on financial security, and will introduce our keynote speaker, Ms. Annette Franke, Chair of AARP Board of Directors. Jean, welcome.
Thank you, Wen. I am thrilled to join you all for today's discussion on health equity and financial security through nursing. The Global Thought Leadership team brings emerging issues to the forefront at AARP and helps to identify new areas where AARP can achieve significant impact. The issue of financial security is critically important, especially given the desperate health and economic impacts our country is facing due to COVID-19. Communities of color are besieged with poor health outcomes, high debt burdens, and little to no financial wealth, leading to widespread insecurity. There is a clear link between health and wealth. The life expectancy gaps between white Americans and people of color exist due to a range of socioeconomic factors, such as income and wealth inequality, gaps in access to health insurance, and uneven access to quality health care. We see the opportunity that nursing brings to provide a pathway to financial security to millions of people. And we at AARP want to ensure that people of color and other historically marginalized groups can access that pathway. We are eager to explore how we can close these opportunity gaps and improve access to training and resources. Now more than ever, we need to collaborate across sectors and to think creatively about how to remove barriers and achieve equity. And now, it is my great honor to introduce Annette Franke, Chair of the AARP Board of Directors. As board chair, she also chairs the AARP Board Governance Committee and Compensation Committee. Annette is a senior financial services executive with prior chief financial officer experience. She has played a key role overseeing AARP's financial health through service on the board's audit and finance committee. Annette serves on the boards of several companies, including Arcos Dorados, the largest operator of McDonald's restaurants in Latin America and the Caribbean, and its largest franchisee. She brings a personal experience to AARP with regards to caregiving, one of our top priorities. Annette has served on the AARP board since 2014. From 2014 to 2018, she served on the board of AARP Services, Inc. A native of Puerto Rico, Annette is the first Hispanic chair of the AARP board. She has a bachelor's degree in economics from the Wharton School of the University of Pennsylvania and an MBA from Stanford University's Graduate School of Business. Annette, please welcome to the stage.
Thank you, Jean. I appreciate the opportunity to be part of this timely and important forum. As board chair of AARP, I am proud that AARP is a strong advocate for equity in healthcare and equity in economic opportunity. We advance equity through our programs and our advocacy, and through collaboration with other organizations like the ones who have come together here. I am proud to be associated with the terrific work of the Center to Champion Nursing in America. When AARP created the center in 2007 with a grant from the Robert Wood Johnson Foundation, AARP was responding to the critical need for all Americans to have access in all settings to highly skilled nurses, now and in the future. The fact that AARP and its state offices represent millions of consumers made for an ideal fit with RWJF. We work together to strengthen the nursing profession and create a healthier America. A central part of that work is achieving greater diversity and inclusion in the nursing workforce and in nurse leadership. I am honored to speak to all of you at this forum who are making such a positive and lasting difference in the lives of today's and tomorrow's nurses and in advancing health equity in our country. Even as it has cast a terrible shadow over America and most of the world, the pandemic has shone a light on the crucial contributions and the everyday heroism of our nurses. The pandemic has also laid bare the long-standing disparities in access to healthcare and access to jobs that have long plagued our communities and our country. With the dreadful toll of COVID-19, with brutally unequal outcomes in who gets sick and who dies, these disparities become harder to ignore. The CDC reports that COVID-related deaths among Black Americans, Hispanic Latino Americans, and Native Americans are much higher than their representation in the overall population. We need to address the glaring disparities that COVID-19 has illuminated, disparities that are painfully evident in lives cut short and livelihoods lost, deeply troubling disparities that will still be in front of us when the pandemic is way behind us. Of course, these disparities didn't just magically appear. They are the product of long-standing inequality that arises from a lack of economic, social, and political opportunities. Online, on the air, and in print, stories and images abound that document these disparities. But we cannot simply catalog these gaps. We have to close them. As we reflect during Black History Month and throughout the year on Dr. King's stirring words and deeds, we are reminded of his summons to the fierce urgency of now. Surely he didn't mean the fierce urgency of totaling up all our problems. He meant tackling them with candor and courage and sustained commitment. And that is what we all need to do. And that is why your work to train a diverse core of nurses and to strengthen nursing is so vital. Nurses have a pivotal role to play in meeting some of the challenges we face, and their capacity to carry out this work is greatly enhanced by diversity. Today, 26% of the nursing workforce is comprised of people of color, far below the nearly 40% of the population they represent. Increasing the number of nurses from different backgrounds, including race, ethnicity, gender, and sexual identity, will lead to better healthcare and better health for everyone. From such diversity in nursing comes a deeper understanding of the elements that affect a person's health and emotional well-being, a deeper reservoir of trust, and a broadening of perspective that takes account of the whole person and results in improved care and treatment. A recent study from the University of Minnesota School of Public Health found that when Black babies are cared for by Black clinicians, including pediatricians, neonatologists, and family practitioners, Black babies and infants are more likely to live and thrive. Nurses from underserved populations will help their communities develop more trust in the healthcare system. This is a crucial factor at any time, but never more so than now when vaccine hesitancy, resulting from the infamous Tuskegee experiment, can impede efforts to conquer COVID-19. To tackle disparities in our country, we need to hone in on the social determinants of health. Factors such as education, access to medical care, food security, housing, transportation, and social isolation. From their close involvement with patients, nurses have a window into the social determinants that often have such damaging effects on these patients. Nurses are good listeners and are also skilled healers. At 4 million strong, nurses are the largest part of the healthcare workforce. And for 17 years in a row, Americans have told Gallup that they trust nurses more than any other profession. This is a time of widespread bitter division and distrust in our country. What better time to strengthen a profession that is in many ways a model of healing and trust? We've looked at what nurses can do for our communities and our country, but what can the nursing profession do for them? Pursuit of this career can be a pathway to economic security at this time when that security is so elusive for so many people, especially in communities of color. According to the Department of Labor's Bureau of Labor Statistics, registered nurses' employment is expected to grow faster than other occupations until 2029, creating 175,000 jobs a year. With an annual salary averaging $75,000 and with benefits that typically include health coverage and a way to save for retirement, nursing is a very sound career. For people from underserved and vulnerable communities, as well as for others, it can be an excellent field in which to build personal financial security and also improve the community's health. Even before the pandemic, looking at data from 2019, the survey of consumer finances showed the typical white family had 8 times the wealth of the typical Black family and 5 times the wealth of the typical Hispanic family. The Census Bureau reported that in 2019, the median Black household earned just 61 cents for every dollar of the median white household, while for Hispanics, the figure was 74 cents. In 2019, the poverty rate was 9% for whites, 21% for Blacks, 17% for Hispanics, and 24% for American Indian, Alaskan Natives. There are so many people in vulnerable neighborhoods who have lost their precarious foothold on economic security because of this pandemic. A career in nursing made possible by financial support in education and by mentoring in school and beyond can be a very promising path forward. Your work at the intersection of health equity and economic opportunity is a source of hope and progress at this extraordinarily difficult time. The magnificent contribution of nurses on the front lines in the fight against COVID-19 underscores the critical importance of your work and I believe should mean new allies for your efforts. One clear lesson from the pandemic is how much we rely upon nurses in every neighborhood, especially where people are most vulnerable, and I believe our country will take that lesson to heart. At this time of greater attention to disparities in America, I am hopeful that we will continue to see barriers falling and access growing for underserved communities when it comes to the nursing profession. We are seeing an increased commitment to diversity and inclusion in the ranks of nursing, including at the leadership levels. At the same time, as Susan pointed out, we still have quite a long way to go. We are seeing collaboration among a wide range of organizations, nursing organizations, RWJF, the American Hospital Association, companies in healthcare, healthcare systems, the AFT, local banks, and many, many others. All of these groups recognize the vital need for greater diversity and inclusion in nursing. At AARP, we are excited about what this collaboration can accomplish as we work together to share ideas with innovative partners, provide wraparound support for nurses of color, and achieve greater diversity and inclusion. I'll close by referring to a Black woman who is a nurse. In fact, the director of critical care nursing at Long Island Jewish Medical Center. I'm, of course, speaking about Sandra Lindsay, who became in December the first person anywhere in the US to get a COVID-19 vaccine. She was eager to take on that role, she told the New York Times, because she wanted to inspire people who look like me, people who are skeptical about taking vaccines. Critically important as it is to overcome the vaccine hesitancy rooted in shameful history, I think Ms. Lindsay's status as a role model, as someone who can inspire people who look like me, goes further. We can use this moment to think about what it would mean to have so many more Sandra Lindsays in the field of nursing and in its leadership ranks, what it would mean for health equity, what it would mean for economic opportunity in communities of color. Thank you for all the work you are doing to speed that day, and thank you all for listening.
Thank you so much for taking the time to spend with us today, Ms. Franke. It's so important for all of us to hear why AARP and AARP Foundation are committed to nursing and diversifying nursing. Now we're going to move on to our first rapid fire panel, Setting the Stage, Financial Insecurity and Inequity in the United States. I'm delighted to introduce to you our first set of panelists. They are Kat Gaugeneier, Director, Racial Wealth, Equity Strategy, Prosperity Now. Dr. Lori Terwinski, Director, Finance and Employment, Public Policy Institute, AARP. Dr. Joanne Spetz, Director, Philip R. Lee Institute for Health Policy Studies. Brenda and Jeffrey L. King, Presidential Chair in Health Finance, and Associate Director for Research, Health Force Center at UCSF, University of California, San Francisco. Dr. Kenya Beard, Associate Provost, Chamberlain University, and our moderator, my good friend and colleague, Barbara Nichols, Executive Director, Wisconsin Center for Nursing and Diversity Advisor, Future of Nursing Campaign for Action. Barbara, please take it away.
Thank you, Piri. Isn't it wonderful to see all of the planning we and our team at CCNA have done come to fruition? It's terrific to see all of the interest in the topic of achieving health equity through nursing, and specifically today's topic on nursing as a career to achieve financial security. It has certainly been an excellent career choice for me. Our first panel today is focusing on the problem of financial security. We have two finance experts who will talk us through the financial security and insecurity in our nation, with an emphasis on financial insecurity and what causes it. We also have a health economist who will help us set the stage as nursing as a viable career for people to achieve financial security. And we have a nurse and a nurse educator who will point out the range of financial challenges among low-income nursing students of color and what could be potentially done to address those additional financial burdens. So let's start with Kat. Kat, help us understand the state of financial security in the U.S., who has it, who doesn't, and how should we understand it? Address definition of financial security and what disparities look like nationally in financial security. How does then financial insecurity affect people?
So thank you, Barbara, and thanks to Melissa and AARP Thought Leadership for inviting me to join you all today for this important conversation about how health equity can be a financial security strategy. The work that I do at the National Intermediary Prosperity Now focuses on asset building. I'm a sociologist and a researcher. I'm also a certified community health worker, or traditional health worker as we're called in Oregon. And the work that we do is really thinking about this North Star of racial, economic, and wealth equity as a way to solve for racial inequality and economic injustice. We think about this along a poverty to prosperity continuum, which could be likened to a financial security framework, right? Really thinking about where people are starting, what causes them to be in the position they're in, what are the consequences they're experiencing, and then what cure can we bring forward? And I love this kind of work because as somebody who focuses on macro level change of public health, really thinking about the socioeconomic and systemic or environmental conditions to bring about different health outcomes is something that resonated with me during my training, thinking about not just curing an issue, but also reducing the harm and hopefully preventing more people from experiencing inequalities, the barriers and challenges that come with that. So I'm excited to be here today talking to you all about, what does equity mean to me? What is the equity lens? And really thinking about how do we kind of stand at the nexus of health and equity and economic justice and think about what kind of options are possible for the low to moderate income, low wealth people that we work with and that we're trying to recruit, bring into this work, who by and large are people of color due to multi-systemic factors. We know that Black, Indigenous, Native American, Asian American, and other people of color really experience the short end of economic justice in this country, which is, I think, what we're hoping to talk a little bit more about today. So what I'm told and what I know is, we have to really understand what it is we're solving for. So who are we centering and what are we solving for as we think about health equity and economic justice? Equity to me is always about the cause, the consequence, the cure, not thinking about what is wrong with the individual, but thinking about the context in which people live their lives, where they work, live, pray, and play. Who is the furthest from justice? Who experiences the most barriers and burdens? What's driving the institutional, systemic, structural inequity and harm that communities of color and low-income communities experience? I think that in this moment, medicine is uniquely situated because we are in the midst of a global pandemic, but also because the Hippocratic Oath and the way that medicine is set up, how to have a duty of care and to do no harm. And what does that mean in a moment of racial reckoning where society is largely saying, despite our best intentions of integration, there are some inequalities that are longstanding, that they're not caused by people's lack of education and motivation. And so thinking about upstream solutions to bring about the kind of economic equity that allows people to have thriving lives. So thinking about, how do we define financial security? And I'm a nerd, so I did a lot of research thinking about this and found some interesting definitions that I think are helpful. Most specifically, thinking about financial security as a driver of internal peace of mind, when you aren't worried about your income being enough to cover your expenses. That was written up by Quicken. There are different ways of thinking about economic inequality, economic injustice, and what it does to people. But most specifically, what we know is chronic stress from impoverishment and other social determinants that bear on underlying health conditions are often driven by underlying wealth conditions, and that this stress increases the allocastic load and leads to these health disparities that then predispose people for differential outcomes when it comes to human-made and natural disasters, pandemics, different things, right? People have less choice and less resources to kind of make the kind of healthy decisions that will protect them, or to make decisions to stay home, to not be exposed to so much risk. And what we know about racism is that, it is differential treatment and differential access to opportunity. There are things around diversity and inclusion that are very important in bringing people into existing systems, but equity really challenges us to think about, is that institution, that system, that structure that wasn't designed for people of color, for low-income people, really ready to accommodate folks as we come in? Or is there something about the structure and system that needs to change? It's both and, right? It's both and. We need diversity inside an institution to be able to think creatively, bring in alternative perspectives. But we also really need institutions, sectors, systems, and structures to be amenable to the kind of change people need to see. So Aspen goes a step further and really talks about the nexus between economics and health, thinking about, this chronic stress, that there are widening wealth gaps based on age, education, and race. Low and moderate income families have already lost 2 decades of wealth. This is before the pandemic. What we see is a great stripping of wealth and income and opportunity for communities of color, most specifically Black women in these moments, as we can see in multiple researches that really give a good line of sight into this. That the median wealth of Black households is 1/10 of that of whites, that women earn less than men, about 1/3 less, and that college debt has reached record highs. And we know that that's kind of distributed across the spectrum from, youth, but all the way up to people who are older, right? 50-year-old and older, they're saying actually hold a significant amount of student loan debts that won't be discharged unless something is done. So thinking about all of these gaps, these are the challenges that people are born into, right? That the zip code is more determinative than the genetic code, but also that we know family of origin means so much as to the opportunities that we'll be able to realize in a lifetime. So, kind of posing the big questions, thinking about, in this moment of racial awakening, what is it that people of color and low-income people have always known that's kind of breaking into the consciousness of the society? What does it mean to say it's not us, it's the system? And how is the system then responsive to the needs of people? Really thinking about the incomes, how people are resourced and compensated for these frontline jobs that often put them in peril. So really thinking methodically about the approach and really centering the needs, the strengths, and the assets of the people furthest from justice is how we get to equity. It's not as utilitarian as diversity and inclusion, looking at, representation and optics. It's really about the process and the outcomes. Are we changing the socioeconomic circumstances for communities of color? These are the litmus tests to figure out if something is a strong equity strategy. So thank you, Barbara. Again, it's wonderful to talk about these issues, and I turn it back over to you.
Thank you, Kat. Now, let's turn to the CCNA team's AARP colleague, Lori. Lori, please explain what are the factors that have led to high levels of financial insecurity? Tell us more about this debt issue, including student loan debt.
Thank you, Barbara and Susan and the CCNA team for hosting this important event today. And thank you also for inviting me to participate. You've asked me to talk about some of the factors that lead to high levels of financial insecurity. And it's a pretty complicated question. There are some parts of financial security that are within personal control. These are things like decisions we make throughout our lives about things related to finance. For instance, do we save for retirement? Do we borrow to go to school? Do we take on debt to finance a new car or a house? There are other parts of financial security that are less within our control. Some of it has to do with where you were born or the financial circumstances of the family that you were born into. What examples did your parents set for how to manage money? How did your family act around certain financial decisions? I come from a family where my parents didn't borrow a lot of money. They were very meticulous about how they spent their money. They didn't use a lot of credit. It was a big deal when I went to college and we had to take out loans for me to do so. So these are the kinds of things that can influence how you manage your financial life when you get older. Now, there are other parts of the financial security equation that are not within our control as well. Things like health status or opportunity. Did you have an opportunity to get a solid education when you were younger that prepared you to go to college? Or, did you have an opportunity to get a good job early in your career? So there's an aspect to financial security that also involves opportunity. And it's true that everyone does not have equal opportunity in this country. So these are things that have an effect on populations as they age. Now, one important part of the financial security discussion is debt. So we used to have a country where you would borrow when you were young. You would have a small amount of debt for student loans, perhaps. You would then, early in your career, borrow money to buy a house. Over time, you would pay this debt off so that by the time you reach middle age, you would be saving money for retirement. You could be saving money toward your children's education, and you would be paying down any debt that you took on when you were younger. Things have changed in America over the past 30 years. The cost of attending college has doubled on an inflation adjusted basis in the last 3 decades. So what does this mean? It means younger students are taking on more student loan debt. It means parents are taking on debt to finance the education of their children. So you have 2 generations. Sometimes you have grandparents taking on debt to help pay for college. And so at the end of the day, you have younger people who can't save for their own retirement. You have older people who are also taking funds away from saving for their retirement. And so it can create an incredible intergenerational financial burden. So there are many things that we should think about going forward. One of the things is, how can we make better decisions about how to pay for college? Or maybe we should make a different choice of college, or we should find better ways to help people pay for it in terms of scholarships and financial aid availability. The other thing that we have found at AARP with a lot of our research is that people are unaware of various programs that can help with student loan repayment. We have seen people who take on private student loan debt, and this is debt not backed by the US government. Those people often have fewer consumer protections. And if you co sign for a loan for your child or grandchild, and for some reason they are not able to pay, you end up paying, you are responsible for paying that debt. And so we often see this create financial insecurity for parents and grandparents when this occurs. So, that said, debt can be a very useful tool to help people achieve financial success and to be able to pay for things that you can't pay for all in one lump. But everybody should take the time to plan to ensure that you will be able to pay any debt that you borrow, and to, and this will lead to more financial security for both the younger generations and the older generations. So I just want to thank you again for the opportunity, and I will turn it back over to Barbara.
Thank you, Lori, for all of that information and for your insights. Turning now to our health economist, Joanne Spetz, whose team manages the campaign's dashboard measures. Joanne, please tell us what your research shows for nursing as a career for financial security and as an effective career ladder, particularly for historically marginalized populations.
Thank you, Barbara, and it's nice to see you. As you know, I've had the opportunity to learn about the trajectory of nurses' careers through decades of surveys that we've done in California, as well as the National Sample Survey of Registered Nurses. Nursing is the largest profession in the United States and offers myriad opportunities for people who might be interested in the field. We can start by asking what makes nursing an attractive career, and there are many, many reasons. Nursing is a mix of scientific skills, interpersonal skills, organizational skills, and well-informed common sense. There are pathways in the profession for people who are very interested in the science of nursing and want to focus on the science, and pathways for people whose greatest strength is their ability to develop strong relationships with others. So the profession works well for a wide variety of people. A person can become a nurse through several different education choices. About half of RNs start with an associate degree, which they get from a community college or a private college. And associate degree programs are widely available, including in some rural areas. They're also quite affordable when they're in the community colleges. We find some people who have a bachelor's degree or even a graduate degree in another field will pursue the associate degree in nursing because it can be completed in about 2 years after fulfilling the prerequisite courses. The other half of RNs are getting their education in bachelor's degree programs or master's programs. The master's programs are usually intended to fast-track people with bachelor's degrees in other fields to quickly get a license and continue towards a master's degree. And both of these programs can be in public and private universities. And some RNs who've worked in other health occupations before becoming RNs can pursue either of these paths. In California, we found that about 14% of our nurses worked as nursing assistants or aides before they went to nursing school, and another 8% were licensed practical or vocational nurses. This latter group of LPNs usually can enter an accelerated RN program and get their RN license in only 1 year, which brings up an important point. Many people are continuing their education after they start their professional work. Last year, more than 65,000 registered nurses whose first degrees were associate degrees got a bachelor's degree in nursing. We know that many of these nurses also go to graduate education, and we know that nurses have long gaps between their degrees in some cases. So the point is that getting a bachelor's or a graduate degree is always an option, even for people licensed 20 or 30 years ago. So regardless of how a nurse enters the profession, there are a lot of pathways within it as well. For people who love the fast pace of the emergency department, you can work there. Do you love working with older adults who may be frail and have complex needs? You can do this in long-term care or primary care. Do you like small children? You can pursue school nursing. Do you like research? There are many different research pathways in hospitals, industry, and academia. And for people who like all of these things, they can follow in the steps of many other nurses who have shifted their career path several times. My own mom, who received her nursing education in a hospital-based diploma program in the 1960s, worked for several different hospital care units, then became a quality reviewer for a company that reviewed Medicare payments, and then finished her career in primary care at a Veterans Administration clinic. So regardless of where you work, RNs have a lot of opportunities, and they also tend to get paid really well for their work, which is why it is such an important career for upward mobility for many, many families. In 2018, the National Sample Survey of Registered Nurses estimated the average annual earnings of RNs was nearly $71,000 per year, including both full-time and part-time RNs in that statistic. Many RNs take time away from their careers to try a different job, attend to family needs, or travel, and nursing jobs are always available to them, both in the US and overseas if you want an international adventure. As a last comment, I want to point out how diverse the RN workforce is and how important this diversity is to patients. In 2019, about 38% of new RN graduates were people of color, compared to about 40% of the US population. The diversity of the RN workforce has been increasing rapidly. I think because it is such an exciting career and also such an accessible career. We're seeing more men enter the profession, around 14% now. And although the data are not very good about this, we are seeing indicators of people who are non-binary gender graduating from nursing programs nationwide. We've been trying to get good data on the LGBTQ representation in nursing, as the anecdotal reports we get from nursing programs indicate that we have many graduates who are LGBTQ, but the data systems are not catching up with what we think is happening in the field right now. I view nursing as one of the most important professions to fostering upward mobility for people in the United States. The profession is open to all racial and ethnic groups, all genders, all religions, and all sexual preferences. And there are multiple pathways to become a nurse, whether you're fresh out of high school or looking for a second career. And once you are a nurse, you can continue to advance your knowledge and skills, and you can be rewarded for it. So Barbara, thanks for being interested in hearing my perspective on nursing in the United States and why it's so important for growth and mobility.
Thank you, Joanne. Now, I would like to wrap up our panel by turning to our nurse, Kenya Beard. Kenya, I believe we asked you to talk about how nursing education can address the high cost of nursing school, including expenses such as books, uniforms, and other fees and living expenses. Please share your thoughts with us.
Thank you, Barbara. It's truly an honor to join this critical discourse. When I consider the financial hurdles that limit access to and hinder progression through nursing school, I wonder how much has changed over the years. I recently reread a study where students were asked what accounts for the continuing dismal number of non-whites in nursing. While Black students shared the false claim that they were not considered bright enough to be successful in nursing, white students reported that non-white students usually cannot afford to go to nursing school and that they do better in lower-level nursing positions. This study was conducted by Barbie and Gibson in 2001, exactly 20 years ago. Fast forward to today, we can see that nursing has not fully escaped that false rhetoric. Nursing is indeed a plausible career that has lifted many individuals out of poverty, both white students and students from historically stigmatized groups. And although in the United States there are more white individuals who live in poverty, that reality has been eclipsed by the disproportionate rate of minorities who are more likely to experience poverty. Some educators have spent the better part of their careers exploring meaningful ways to strengthen racial and ethnic diversity in nursing. However, the return on investment has been disappointing and requires a radical shift in how we operate. We see that the diversity of our society is growing at a rate that is much faster than the nursing profession's ability to diversify. And why is that? to your point, Barbara, the cost associated with nursing school has served to some extent to serve as barriers to stronger admission and graduation rates. So what can we do about it? Well, three things. One, access to scholarships. This has helped to mitigate tuition costs and offset lab fees, but we need to rethink how scholarships are designed and who we cancel out when the scholarship application becomes onerous and a hurdle in and of itself. And two, open education resources. OER promises to eliminate the cost of textbooks, but it too requires time and faculty commitment to identify appropriate material and resources. And then thirdly, grants, because they can provide students with the stipends that they need to address things like uniforms and travel-related costs. While these three actions have helped to reduce the cost of nursing school for some nursing students, they have failed to make nursing school more accessible to students on a national level. And they have not eliminated the upstream factors that continue to undermine diversity efforts. Those upstream factors that continue to undermine diversity efforts are things like structural racism, because they contribute to the persistence that we see in housing instability and food insecurity. And we can see that how collectively this hinders access and academic progression. So yes, there's plenty of data that supports that poverty influences academic success and limits choices. Students have to decide, do I pay for transportation to school or do I pay for rent? And what about the need to work? In nursing, we teach and respect Maslow's hierarchy of needs, but what happens when a student's basic needs are not met? We know that with poverty comes the demand to work longer hours to offset low wages, and the hours spent working comes at a huge price. And for some, that price has cost them their seat in nursing school. So yes, poverty begets poverty, and it's sickening when nursing students share that they are living in a car or remote learning has left them without access to Wi-Fi or technology. So what can we do on a national level, on a broader level, to address the gap in graduation rates for individuals living in poverty and those who are not? For some, this gap widens in part because of time or the lack thereof. Who is more likely to be robbed of the hours that were meant for studying, but the hours now have to be shaved off to look for housing, or work overtime to pay for necessities like food, shelter, transportation, and access to Wi-Fi? Yes, scholarships, grants, and OER are actionable items, but it's time for our profession to strengthen transformational relationships and invest in students throughout the 4 years of their BSN journey, so inequities do not continue to serve as a catalyst for a lifetime of poverty. Let us look at the accountable care organization model and how hospitals are using ACOs to reduce cost and improve access and healthcare quality. What if institutions of higher learning collaborated more intentionally with community stakeholders, food pantries, or even the Department of Social Services to ensure that no student has to sleep in their car or lacks access to food? What if we strategically partnered with internet providers to ensure access to Wi-Fi for students at a reduced cost? I say all this to say that eliminating poverty is a national priority that requires leaders to reconcile the fact that poverty seeks to pull students away from their ability to become a nurse and thwarts the profession's commitment to graduate a more diverse workforce. The pandemic has revealed novel opportunities to improve access to nursing and finally mitigate the broader impact of poverty on academic success. The nursing profession, along with other healthcare disciplines, has the bandwidth to address income inequality and poverty. However, we need a national plan that actualizes the power of education and collaboration if we are to truly disrupt the cycle of poverty, admit and graduate a nursing workforce that mirrors the population we serve, and improve the health of our community. Thank you so much, Barbara.
Thank you so much, Kenya, for all of that information. And thanks to all of you, to all of our panelists, for helping to explain financial insecurity as experienced by vulnerable communities, especially among low-income people of color, and how this impacts and hinders nursing education's intent to enroll and graduate more diverse students. Piri, I'm ready to hand this back to you.
Thank you, Barbara. Wow, what an extraordinary group of panelists. This conversation really lays the groundwork for what we're here to discuss today, which is nursing as a career to achieve financial security. Melissa, let's unpack what we heard today.
Thanks, Piri. I'm really pleased to join you all today. My name is Melissa Grober-Morrow, and I am Thought Leadership Director, Financial Resilience at AARP. I really loved what we heard today. I thought that Kat and Lori did a great job at the outset of helping us understand the macro conditions underlying the disparities in financial security and economic opportunity in this country. I was taking a lot of notes as Kat was talking, and I loved what she said about we have to center the needs, the strengths, and the assets of people furthest from justice in order to achieve equity. And Piri, I would just love your thoughts on that. You know, what can the nursing field do to center the needs of historically marginalized populations?
Yeah, that was a really powerful talk. The part about the cause, the consequence, the cure, and understanding the context for individuals. So, just speaking personally, nursing was a route to me to get out of poverty. Um, I felt like when I was trying to choose a career, there are the things that I love to do. Definitely science, definitely caring for other people. But I was tending toward things like literature, which I also love, and sociology, love sociology. But I felt like, given my financial circumstances, I didn't have the luxury of choosing those careers that you don't know if they're going to be stable or not. So nursing was really appealing because it had so many of the things that I was looking for. It has the science of the body, has how to heal and how to take care of people, and it had a financial stability that I knew would be helpful for me. And honestly, it's changed my life. And I feel passionate about having other people see nursing as something that's achievable for them and that can also help them move out of poverty or low income into a middle class life.
That's really inspiring. And I imagine that it's been the case for a lot of people that this has really been a pathway. This is what we're talking about here. But it sounds like, you know, there are also huge costs that people have to undertake as they become nurses. I mean, there are the costs of college that Lori presented to us, that the costs have doubled in the last 3 decades, and that we now have parents and grandparents taking on some of that debt to support kids and young people going to nursing school. And and adults too. And I'm wondering, you know, what can we be doing? I mean, there are some uh, really great suggestions from Kenya around making sure that scholarships cover more than the tuition costs, that we're covering the costs of uniforms and textbooks. Um, but it seems like it may not be enough, or the financial burden of carrying debt for a long time can be really crushing to a lot of people. Um, so I don't know if that's something that you know, you want to remark on. How has that financial burden, you know, what factor did that play in your decision, and how do you see it affecting students?
Yeah. I feel like the landscape around student loans and the expense of education has changed dramatically from when I was in school. So students are taking on a lot more debt than they ever did. And I thought it was interesting. One of our speakers was talking about the circumstances of finance, like, the area that you were born into, your family, what those circumstances look like. and also what knowledge you have about how to handle your money. I mean, we don't really talk about that in high school or at community college. We don't talk about it in nursing school, really. I think that there could be an emphasis on talking about what debt looks like, what is healthy student loan debt, and how is it going to look once you're working to pay off that debt. I tend to advise students to think about it as a return on investment. So you're investing this amount of money, and what is that going to look like when you're working? And you have to consider all the things that are happening in your own life. Do you have kids to support? Do you have another source for health insurance? Do you have other loans to pay off, maybe from a previous program or a different career? You know, all of those things come into play. And I think that we need to be really strategic with our potential students about what that financial burden is going to look like over time.
Great. And I'm just seeing some of the comments that are coming in. We've got some really great ones. I want to just remind folks that there's a dashboard with data that came up in today's discussion, as well as the last discussion that you can find at the Campaign for Action website. And raise that AARP, our Public Policy Institute, as well as our thought leadership teams, are really focused on being a think tank alongside CCNA and thinking through these issues together. And we would love your thoughts. I think we've gotten great food for thought here about what more we can be doing as a field, and would love thoughts from the audience about how to support students, how to ensure that nursing is accessible to more people. And we've got more great discussion, of course, coming up in the next panel that might get into that. Piri, are there any other points that really stood out to you in this discussion?
I thought that all of it was really interesting. I found myself, definitely taking notes and looking up different things. I know that our school has been talking about this idea of open education resources. And so I definitely want to look a little bit more into that. I mean, schools should be taking steps to mitigate the costs for their students. The other thing I want to mention is understanding how the social determinants, we've been calling it the social determinants of health, but what about the social determinants of education? What are those things that we don't understand that our students are going through? Like, I think it was Kenya Beard mentioned students living in their car. And I actually had a student at one point who told me that her car had broken down and had caught on fire. And I was definitely concerned and, asking her, let's talk about different ways that we can get you to school. And she's like, Piri, I don't think you understand. I've been living in my car. And I was just like so blown away. I had no idea that the student was in that sort of a place. And I think there are a lot more students who are struggling financially far more than we realize, who are housing insecure and food insecure. A lot of times we think that, well, if they can afford the tuition, they must be able to afford other things. And that's an assumption. There are a lot of students that are struggling. So I think it's important for schools of nursing to do assessments, to be really open to what they may not know about their students, and to really be active in reducing the amount of costs and increasing opportunities for scholarships and grants. Um, yeah, thank you, Melissa.
Yeah, I agree with that. I think we heard great comments from both Kenya Beard and Kat Gogenauer at Prosperity Now, talking about the need to disrupt the cycle of poverty and stress being, tied to underlying wealth conditions. And I think that uh, uh, again, Kenya Beard brought this national call to action. We need a national plan, she said, to actualize the power of education. Um, and collaboration to disrupt the cycle of poverty. I think that's true. I mean, I think that we're seeing this, of course, widespread poverty worsening right now in this time of COVID, and I mean, we also clearly have a huge nursing shortage, and so it may be time that we, have a more comprehensive plan that goes beyond individual nursing schools. And as somebody who's not part of the nursing profession, I am asking myself, what are those opportunities? What can the Campaign for Action be doing more broadly? And is that something that you feel like you can speak to, or is that something that we should come back to at a later point, Carrie?
I think probably both. And I'm just looking over at these wonderful comments that are coming in from different people, about scholarships, and the qualifications for scholarships and things like that need to be broadened. But I think that this is an important conversation that we need to, I agree that we need to have it on the national level, perhaps using platforms like these to make recommendations. I think a lot of our nursing professional organizations are in a great place to also make recommendations for schools of nursing to be aware of and active in trying to solve this problem, address this problem. And I think it's something that we as individuals within schools of nursing need to be aware of too. And I just can't emphasize enough how often we make assumptions about what's happening in students' life. And that's to the detriment of students. That's another added burden when people who are struggling financially are thought to be less motivated or less committed or not acting in a professional way. The student who comes in with their uniform not laundered and ironed, is that an issue of them not understanding the professionalism around how we look and how we dress, or is that an issue of lack of access to some of those things? So, yeah, I think that we need to be having this conversation for quite some time, Melissa.
Thank you, Perry. I think we could go on and on, but we do have much more content to cover. So I'm being prompted to wrap up our conversation now. Thank you.
Thank you, Melissa. Okay, so Melissa, then how about if I introduce our next panel? This next panel will focus on obstacles to more diversity in nursing. We have Dr. Lenora Campbell, Dean, College of Health and Human Sciences, North Carolina Agricultural and Technical State University. Dr. Ladonia Patterson, Lecturer, Georgia Baptist College of Nursing, Mercer University, Georgia Nursing Leadership Coalition, Diversity Co-Chair, and Mr. Roderick Hadnot, Home Telehealth Healthcare Coordinator, Veterans Affairs and Director of Programs, Center for Education and Opportunity. This panel is moderated by Dr. Lisa Martin, Associate Professor at St. Catherine University and Diversity Advisor, Future of Nursing Campaign for Action. Lisa, please take it away.
Thank you very much, Perry. Hello, my name is Lisa Martin, and I'm a member of the Lac du Flambeau Band of Lake Superior Chippewa Indians, and also the immediate past president of the National Alaska Native American Indian Nurses Association, otherwise known as NANA-INA. It's a pleasure to be with you today. The first panel focused on the problem of financial insecurity experienced by vulnerable populations and its impact on diversity in nursing. This panel will discuss in more detail the obstacles that people from vulnerable communities experience that prevent them from entering nursing, and will include brief descriptions of what can be done to overcome the obstacles. While I am honored to moderate this panel, I am a participant as well. We were hoping to include another Native American nurse who could share with us the obstacles that Native American people experience that prevents many of us from becoming a nurse. Unfortunately, our colleague was unavailable, so I am going to provide that information. I would like to share with you some points about Native Americans' barriers to becoming nurses. Over the past decade, there have been far fewer Native Americans graduating from schools of nursing when compared with all other underrepresented groups in our country. Native American nurses are greatly needed, as they are more likely to serve Native American communities during the course of their nursing career and can play a vital role in healthcare, understanding how to reverse the profound health disparities in Native Americans. In trying to understand more about the low numbers of Native Americans in nursing, we have found that there's a shortage of nursing programs that provide holistic support to underrepresented students like Native Americans, such as academic, social, financial, mentoring, and cultural support. This type of holistic support is vital to attract Native Americans to the nursing profession and assure success. There is also a shortage of nursing faculty who are Native American to serve as important mentors and role models and oversee progression through the nursing program for Native American nursing students. Nursing faculty serve a vital role of supporting the student through the rigorous academic program of nursing and also need faculty resources towards the school. Finally, most nursing programs do not recognize the Native American worldview in their curricula. And this refers to the cultural, historical, and political realities to Native Americans towards what they are learning in nursing. This is important so that the student is welcomed and can apply better, prepare for improved healthcare of Native Americans. So here's what can be done to overcome these barriers. First, nursing programs can broaden the supports available to students in their programs. So, including a network of support areas such as academic, social, financial, mentoring, and importantly, cultural support. This network of support is vital for the length of the student's time in nursing school to see the best graduation outcomes. Second, provide educational resources to support nursing faculty to engage and mentor Native American nursing students. Resources are needed to promote culturally responsive engagement, teaching, and learning. Lastly, greater recognition and welcoming of the Native American worldview in nursing curricula. This can positively impact both nursing faculty and students. Such welcoming prompts greater understanding and learning on the best culture-based healthcare for their future nursing practice. Thank you for letting me share all of this information with you. And for more information on Native American nurses, please visit Nana Ina's website at nanainanurses.com. You can also reach out to the Campaign for Action, and they can connect us to each other. Now, I would like to turn to my fellow panelists, and I will start with Lenora Campbell. Dr. Campbell, can you please explain what are the obstacles that exist for African American people to enter nursing? Are there promising practices that help address this?
Thank you, Dr. Martin, and thank you to the CCNA team for inviting me to join you today. Thank you for this, and thank you for these really important questions. We know that workforce diversity plays a critical role in the health outcomes of populations. So I'm pleased to talk with you about African American and nursing. And I would like to address 4 areas I believe are important obstacles in terms of African Americans and underrepresented minorities in nursing. And they are science and math proficiencies, admissions criteria, financial barriers, and mentoring. So in terms of science and math proficiencies, we know that students coming into nursing need to have a certain level of proficiency in science and math. That is simply foundational to so much of the content in an undergraduate nursing curriculum, and it's foundational to the care that they will provide. But one of the obstacles for African Americans and underrepresented students is preparation in science and math. And this is reflected in SAT, TEAS, and other standardized testing metrics. And we also see it reflecting in performance in college and university courses as well in science and math, especially in science. We are, and I think we all are aware that many minority students are coming from schools that are under-resourced and have been since their beginning for a number of reasons, including marginalization and systemic and structural racism. And as a result of that, many of these students may not have had the guidance and opportunities needed to focus and excel in these areas. But there are clearly things that we can do. One is that we can make it clear to our pipeline of students starting in the primary grades that nursing is a STEM major. I know that's controversial, but nursing is a STEM major. Science and math courses are important. And this is especially true because nursing is a female-dominated profession. And we know that girls, especially African American and underrepresented minority girls, typically shy away from science and math. So a promising practice is for nursing to join other STEM disciplines in encouraging African American and other underrepresented minority students in math and science. And this creates a diverse pipeline, and it creates a pipeline of students that will have success in getting admitted into nursing programs and completing them. And schools of nursing also can partner with under-resourced schools to provide support and mentorship in science and math courses, and to help students understand how science and math are essential in learning to become a nurse. The second barrier that I would like to mention is admissions criteria. A number of the metrics that schools use to make decisions for getting into nursing programs places many minority students at a disadvantage. So if we focus only on academic metrics, grade point average, SAT, ACT, tests, et cetera, we will continue to trail in workforce diversity. Many minority students struggle or do not find their highest level of achievement on standardized tests for some of the reasons that I stated earlier. So a promising practice is to develop an admissions process that is holistic in nature, one that considers more than the usual academic metrics, and to really look at an admissions process that considers characteristics or other attributes or other talents and passions and skills of the applicants. The third barrier that I'd like to mention is financial, and financial barriers abound. You know, many of our African American students must work to support themselves and oftentimes to support families while they're in school. I am amazed at the number of students who are literally deciding to either purchase books or to pay their rent or buy food. And many of them choose to not purchase their textbooks, which severely compromises their ability to be successful. They may also choose to take that extra shift, which again takes away valuable time for study. So an important strategy is to provide financial support for students. Even providing small scholarships to assist with books or other fees in nursing can be extremely helpful and can really make the difference between being successful and failing. And then finally, mentoring. We know mentoring is an important strategy for helping students to be successful in nursing school, especially underrepresented minority students. And many of them, however, do not receive the mentoring that they need. At predominantly white institutions, oftentimes the mentoring is left to minority faculty. And this compromises both the students, because the students oftentimes do not receive the mentoring they need because of lack of resources, but it also compromises the faculty, particularly in terms of their longevity and success in that academic environment, because the tenure demands and the workload demands of African American or other represented minorities are the same as their white counterparts. So if we add on top of that they have to carry the lion's share of mentoring, then it compromises their ability to be successful in those environments. So a strategy is to solicit the assistance of African American alumni or local National Black Nursing Associations or Chi Phi or National Hispanic Nursing Associations or any of those entities, because they can really help with the mentoring in our nursing programs. Students really do benefit from a nursing school that has a structured mentor program, but this does require that we have a diverse faculty. So nursing leadership and faculty should have very deliberate and intentional discussions about their diversity composition. We all should aim to have a diverse faculty comparable to the population. And we should all have that as a metric, that we should evaluate the diversity of our faculty with the same intensity and focus as we evaluate student success and faculty scholarship. And then finally, we should work to create an inclusive environment. So there are a number of obstacles and barriers that are important for increasing the number of African Americans and underrepresented minorities in nursing. But these are the ones that I've mentioned and provided some recommendations for how we might address them.
Thank you, Lenora. We at the Campaign for Action are also so grateful for the leadership you offer and for the work you are doing with Cone Health System in Greensboro, North Carolina. We look forward to hearing how their project is going that is piloting the campaign's Health Equity Toolkit. Now, I would like to ask LaDanya to join us. LaDanya and Roderick have ideas and projects that are similar to each other. LaDanya's project is based on her scholarly research and is a project that is now supported by the Campaign for Action's Nursing Innovation Fund. She and her colleague from the Georgia Action Coalition's Diversity Committee, Dr. Gia Daniel, are leading this effort for the Georgia Action Coalition. Dr. Patterson, please briefly describe your project. Can you also please address the unintended consequences there might be for low-income people of color in pursuing a career in nursing, especially through a career ladder? We understand that because of competing real priorities such as financially supporting their families and paying for living expenses such as private transportation, that certified nursing assistants often remain in that role. How can we help make sure that people of color at the first step in career ladders can be supported to advance their career and hopefully continue to support their families?
Thank you, Dr. Martin. These are such important questions, and I'm happy to respond to them. I'll start by sharing just a little bit about my project, which is the High School to Higher Ed and Pipeline Program. As you mentioned, I developed the program alongside Dr. Gia Daniel in collaboration with other members of the Georgia Nursing Leadership Coalition. The High School to Higher Ed Pipeline Program is a pilot program that was designed to facilitate entry into the nursing profession for Black men in the metro Atlanta area. This program will provide resources, support, guidance, and mentoring to Black male high school pre-nursing and nursing students at multiple stages so that they can persist along the pathway to becoming registered nurses. One other goal of this program is to support Black male registered nurses who are serving as mentors for the program and advancing their own careers and pursuing graduate and doctoral degrees. So when we say high school to higher education, our aim is really to illuminate for Black men the pathway from high school all the way to a doctoral degree in nursing and to support them along this path. And this can be really important to mitigating some of the barriers that prevent Black men from entering into the profession. Now, Dr. Martin, you mentioned or you asked about how we can help make sure that people of color who are at that first step in the career ladders, typically these are individuals who are certified nursing assistants, how can we help them and make sure that they are supported in advancing their career and to become registered nurses? I think implementing similar pipeline or pathway programs could be really helpful. While it's absolutely true that some may linger, we'll say, at that first step because they are financially responsible for caring for their families, I've also witnessed firsthand throughout my own career that there are other factors that influence the reason why they stay at this first step. Finances or lack thereof heavily influence their ability to move forward on that career ladder. And also, these individuals may need support in navigating the admission process for academic institutions. And they may not have been exposed to all the ways in which one can advance their career in nursing, and they may not be aware of all the opportunities afforded to them. And so, in this sense, developing a pipeline or pathway program that offers support that offer support for all of this could be really effective in helping those at that first step to progress along the career ladder to becoming a registered nurse. And I also see this as a wonderful opportunity for healthcare facilities and academic institutions to really come together to collaborate to develop this pipeline program, because if we invest in moving individuals along the career ladder to becoming a registered nurse, it's helpful not only just for that individual, it helps the healthcare industry and also the profession, considering the shortage of nurses that we have. So looking at how we can invest more into developing pipeline programs to work with those who are at that first step in the career ladder, really providing holistic support to helping them progress and move towards becoming a registered nurse. In thinking about developing that pipeline program, it might also be worth it to provide financial incentives for advancing along the career ladder for certified nursing assistants as they become registered nurses. That could be impactful because oftentimes individuals are competing with taking time away from work to go to school and pay for school, which costs them money, and earning money, for their families. So if there is a way to allow someone to exist in a pipeline where they can be incentivized for moving along the career ladder so that they're still able to provide financially for their family, that could be helpful as well. And, the financial incentives could come in form of tuition reimbursement or even scholarships, so potentially if they do pursue a degree in nursing, scholarships can help so that they don't have to repay so many school loans, or even a bonus. Unfortunately, the current economic state of Black and Brown communities may make it very difficult for many to prioritize going back to school, like I said. And so if we really look at how we're developing a program to support them, that could be really helpful in helping these individuals move along the career ladder and allow them to pursue higher education while still earning income to support their families, and finding ways for community partnerships and collaborations, can be helpful. Whether we're investing in a pipeline program for Black men or the certified nursing assistants, it would really have a positive outcome on healthcare, society, and of course, the nursing profession.
Thank you, LaDanya. It is certainly interesting to hear similarities experienced by African American and Native American people. We will now turn to Mr. Roderick Hadnot from Texas. He himself has an interesting personal story as far as his journey into and through nursing. Mr. Hadnot, can you please briefly share your story and through it describe the obstacles that men of color experience that prevent them from entering the nursing field?
Thank you, Dr. Martin, and to all of the thought leaders, AARP, the Robert Wood Johnson Foundation, and all the wonderful thought leaders and colleagues that are on the call. Just a little bit about my story as a registered nurse and a male nurse. I started off as a certified nurse assistant and progressed my way to licensed vocational nursing, which is considered to be licensed vocational nursing in Texas. That is what it's called. And also with progressing to be a registered nurse, went on to get my 2-year, 4-year degree, and then obtained my master's degree in nursing education. It was kind of challenging, really becoming a registered nurse. Having really focused on sports in high school, I really thought that I would go on and having a career in sports, but that didn't prove to be true after injury my senior year. So I kind of wondered 10 years of what I should do or should not do. And nursing really came along. I stuck with it and really transformed my way to becoming a registered nurse. If I have to look at it, I had an opportunity to work as a nursing supervisor as a registered nurse in a hospital. And if I look at men in nursing and versus females in nursing, I really have to focus on the I care format. I had a blessed opportunity to be a nursing supervisor in a hospital And I learned a little bit about my patients while working as a nursing supervisor. I found out that I was taking care or helping to care for individuals who literally had their name on buildings because the community celebrated them with having their name on a building. I also took care of people who didn't have their name on a building because they were homeless. They had no building. Took care of individuals who had really great resources and some who had limited resources. But the common theme for it all is that when the individuals came to the hospital, they just looked for someone who cared. So that became the theme of everything that I do is I really care. So when it comes to men getting into nursing or men of color into nursing, there are some things that we need to look at. There are some barriers to men getting into nursing, and some of those barriers focus on perception and also promotion. And when it comes to perception, with the industry being mostly a female profession, there is a perception that the profession is only for females. That is far from the truth. And when we look at another barrier, it is promotion. When we look at some of the textbooks, it seems that a lot of the texts focus on women or females in the profession, and the promoting aspect of being a nurse is not there when it comes to textbooks and film and things of that nature. So ironically, one of the things that we can really do to help remove those barriers are actually the same things that are the problems or situations. We should have a better perception and also promotion. We should fight to basically improve the perception of who nurses really are. If the individual or the general public can look at the heart of a person, they can actually see that they care enough to take care of them, no matter who they are. So looking at the perception, one of the main themes that came with perception and promotion, one of the main themes that came about is the theme of mentorship. As the director of a newly founded organization, Start Health, or the Center for Education and Opportunity, we've started the STAR program. The STAR program focuses on nursing education to help improve health outcomes through nursing education, more specifically focusing on minorities in healthcare, and even more so men in healthcare, namely nursing. And we formed what is called the REACH program. In fact, the inaugural class or Zoom meeting for that starts tomorrow, where we're working with a local high school, and we are going to Zoom into their PE classes to improve minority men or young men getting into the health sciences, more specifically nursing. And we are actually going to have YouTube videos that will present the campaign, so to speak, to help improve the perception and the promotion of men getting into nursing as well. When I spoke with one of the counselors at the local high school, she stated that most of the CNAs in the program, they have a CNA program here in Texas, and you can become a certified nurse assistant while in high school. And most of those programs are females, and you have some men in the profession, but they're mostly of Asian population. When we look at the demographics of this area, we see mostly minorities of African-American descent and also Hispanics. So the goal is to increase the number of Hispanic men and also African-American men in the Certified Nurse Assistant program at this particular school. And the way we're going to do it is, like I said, we're going to go through the programs or to the schools via Zoom meetings, and have those meetings to encourage the young men to join the CNA program, or to even have them to look into other health science fields and help them to find the schools that actually can be associated with that. So we're looking at all different types of things to help mentor them. I would have a vision that we could also look at some of the individuals who are educators teaching science. I know one of our colleagues just talked about how we need to focus on science and math and those things. We really want to focus not just on the students, but also focus on the educators who are teaching the individuals biology, who are teaching science. We want to support them as well to help bridge the gap that may exist between teacher and student. So if I had to look at it a little bit closer, we can actually look at the public as well and improving the perception by actually talking to men of color who have no desire to be in healthcare at all. And these are individuals who may be pastors and preachers and politicians or the barbershops or just general individuals that we can talk to gain their insight on how they see men in nursing and actually share that with the students to see that a lot of men would go into nursing if that perception was not there anymore. So to gain their insight is a great idea that we're trying to do. But one of the main things I really want to do is to treat nursing education for young African American men or Hispanic men or men of color like it's a recruiting process for real. When we look at the NBA, when we look at Major League Baseball, when we look at the football, NFL, we see at the collegiate level between college and high school, they're being recruited highly. So I would like to be able to create a system to where we can recruit individuals just like they would be recruited to go to major universities to play any type of sport. We can even have a signing day. So basically, I want to look at this person may be good in math or they may be good in biology, but maybe may not be so good in reading or anything like that. But yet still, we can focus on what they are good in. The local schools can send them invitations to join their schools and we can recruit them just like they're being recruited to play sports. I think it puts a different spin and perception on the idea that we're not just looking at playing sports, we're looking at the education part of that. So I think that is not far-fetched. I think it's a realistic thing that we can do right now to increase the amount of African-American men, Hispanic men, or men of color into the field of nursing and any type of health science. But we have to start with what the themes are putting out there, and that theme is mentorship.
Thank you so much, Roderick, for sharing your personal story and your insights. It is so encouraging to hear your story, and I look forward to helping you through the Campaign for Action to help you achieve your dream. I also want to thank LaDanya and Lenora for sharing their thoughts and stories of their leadership, and I look forward to the campaign's continued work with you as well. At this point, I'm happy to turn the program back to Piri.
Thank you, Lisa. Again, another panel of people who are just simply amazing, sharing their professional experience, the project that they're working on, the personal experiences. I just have so much to think about, and there's so much to talk about. Melissa, what were your thoughts about what we heard?
Yeah, no, I totally agree. I think it was fascinating to hear not just about the obstacles, but solutions from each of the panelists about how we can get more historically marginalized populations into nursing and really recognize them as whole individuals who need to be supported in many ways. So, mentorship came up multiple times, and I know we had a big discussion about that at the first forum in January. And um, I think one of the points that has gotten a lot of attention in the comments that I loved also was Mr. Hadnot's recommendation to think about recruiting in terms of sports recruiting. I mean, what a great analogy. I think he said we could even have a signing day. I mean, that could, drive not just greater recruitment for men into nursing, but, I think it can make it seem like a really exciting profession for people who might not have considered it before.
Yeah, I agree that that idea was really intriguing me. As somebody that has never been all that interested in sports, I have wondered before, like, why don't we put these resources into things like healthcare where there can be such immediate impact? But again, I want to disclose that I'm not a sports person, so I don't quite get it like everybody else does. So yeah, that was really wonderful. And before we move on too far, I just want to make sure that everyone knows that at the Campaign for Action on our website, we have dashboards. So I saw a couple people in the chat mentioning things about dashboards and things like that. There was also a comment. There have been a couple of comments that I think are really relevant and valuable. And one is this notion of social uplift. right? We want to make sure that there are folks from all sorts of demographics that have access to nursing. And I also want to touch on this notion of deficit-based thinking. And what that means is that we assume that there's something wrong with our students when they're not successful, rather than looking at, again, the system and the context and the opportunities that students have been allowed along the way. I mean, when we're hearing some of these stories, we're hearing about people who are extremely talented, that they have made it so far, overcoming many of the barriers that are in their lives. So they're not like mediocre students that, maybe we should or shouldn't allow them into nursing school. They're highly qualified, highly motivated people. And we need to be looking at, I mean, we've been talking about holistic admissions, and what are some of those additional criteria we should be looking at? We should look at distance travel. Where did people come from? Where did they start? And how far have they had to go in their journey to get here? I mean, that really speaks to people's resourcefulness, their ability to understand how to navigate systems and people and barriers and all of those things. So I just think that that's a really important thing for us to think about when we're talking about students. Melissa, what are your thoughts?
I couldn't agree more. I think we tend to, in this country, not see the obstacles that we're putting in front of people in achieving higher education, and put the emphasis on the individual to lift themselves out of poverty. When many times, there is a much larger, much higher hill for them to climb than people, white people, people who have a lot more resources. And I think we need to learn a lot more about what the needs are of students who are interested in becoming nurses and who are interested in moving up the career ladder. I thought that uh, Dr. Patterson had a great point that there may be ways that we can financially incentivize people in being able to move along the career ladder, going from nurse assistants to becoming nurses, and then perhaps into specializations. But we need to think about what are those barriers in place, and how do we ensure that that all people are able to bring their full selves and not be distracted by and have the stress, the toxic stress that can come with figuring out how they're going to make ends meet and how they're going to get to their clinical assignment.
Yes, definitely agree. I also wanted to note a couple of the comments where people have said, what if we simplify the process for applying for scholarships? And what if we simplify the process for applications? Something that I heard recently that bothered me was that there have been students who are qualified, who have applied for programs, and because they didn't realize that it could take a registrar's office, up 8 to 12 weeks to get their transcripts out, that they technically had a late application, and did not make it into the admission cycle. And those are things that are institutional issues that should not serve as barriers for students. We can up our game on the School of Nursing side and with our pre-health advising so that those sorts of things don't happen. And the people that are likely to be most affected by those sorts of little insider knowledge types of things are students that are first generation students, and those students tend to be disproportionately low income and students of color. So those just should not be barriers for folks at all. Um, Melissa, I wanted to ask you, there was some talk in the last panel about this notion of a think tank. And I wondered what your thoughts were on having a national think tank about how we can solve some of these problems.
Yeah, I mean, I think that we do need to have, multiple sectors coming together here. I mean, again, we at AARP have a lot of people working on the issues of financial security, and lots of other organizations are in that space as well, and really thinking about how we can infuse equity into the conversation and ensure that. Again, people from historically marginalized populations have the same opportunities and the same outcomes ultimately as the rest of the population, and that we can aim higher. We can enrich experiences for everybody. And so I think that there's a lot to be learned across sectors about how to ensure equity. And I think it would be great for us to really be leaders in this space, at the campaign and at AARP and with you all in this webinar today, and thinking through some of these solutions for removing barriers and ensuring that we can have full participation in populations that really have not been supported, not just in nursing schools but in our education system broadly. I think Barbara Weatherford made a really great point in the comments in the chat box. She said, even with financing, there are stressors that students of color face in nursing programs, and that they need to feel that they belong, they are understood, and to see others that look like them. And I think that that's the case for everybody in every profession, and particularly with the needs so high in nursing. We all need to be working together, through think tank, but then also through action, to take steps. And she mentioned that the dean of her school is providing emergency grants, and I've seen this across the board in undergraduate programs, that many more colleges are are finding students struggling with just making ends meet as students. And so, that may be an easy solution. I mean, access to funds can be difficult in itself, but there are grants available. And so maybe that is a solution that more schools of nursing can look to ensure that their students of color are not struggling as they are in school.
Yeah, Melissa, I can't help but think about the pandemic and how that is exacerbating so many of these issues that have been long-standing and oftentimes unrecognized. Now we're seeing it in a way that we haven't. We're seeing the inequities, and I think that this is true in schools of nursing as well. That our students, our single moms are struggling with, trying to go to school and trying to help homeschool their children, and then finances are an issue. So I have heard of multiple schools, my own included, increasing the amount of emergency funds that are available. And I laud that. I think that schools should do that, but not as the only that. We really need to look at this from a systemic perspective and go back to the root of the problem, which is often things that are happening before our students are even in nursing school. I think that projects like Ladonia's, I mean, what a wonderful sort of a project that would be so amazing to see that mirrored, across the country, that we're going back to high school students and giving them the idea, letting them know that there's a spot for them, that they can be successful. We had somebody on, one of our panelists before, that was talking about focusing on science skills for girls and students of color. Like, that pipeline goes back a long way, and there are multiple critical touch points along the health professions pipeline that we should probably be paying attention to. Again, back to Mr. Hadnot's idea about, just this really intense and robust recruitment and acknowledgement of people that get in, and doing that sort of on a national level. I think that there's just a lot of potential here. I am so impressed by the scholarship of our speakers, by the posts that are being put into the chat box. This is just a really exciting time to have this conversation.
I totally agree. And yeah, I mean, I worry about this period of time when, primary school teachers, in many cases, many communities can't see how, their students are struggling with virtual education. Um, but clearly we could talk about this for a long time. I know that we need to move on to the next panel. So, Carrie, why don't you go ahead and introduce our last panel for the day?
Okay, we are moving on to today's final panel. This one will focus on solutions to achieve diversity in nursing and financial well-being. Our facilitator for this panel is Dr. Antonia Villarruel. professor and the Margaret Von Simon Dean School of Nursing, University of Pennsylvania. Dr. Villarruel is also the co-chair for the Future of Nursing Campaign for Action's Strategic Advisory Committee. With Dr. Villarruel today are Mr. Philip Weinberg, President and CEO, Strive International, Dr. Walina, also known as Alina Gould, founder of the Diversity in Nurse Anesthesia Mentorship Program. And finally, Dr. Charmaine Lawson, founder of NOLA the Nurse and House Call Nation. Tony, take it away.
Thank you, Piri. And I want to thank Susan Reinhardt and Sue Hassmiller for inviting me to join you today. While I am Dean of Nursing at Penn, as a student, I too had to worry about how I was going to find the resources for my education. I was a first-generation student. And as Dean, I hear the concerns and the sacrifices of our students. This is clearly a relevant panel. We just heard about the challenges of financial insecurity and how they create obstacles that prevent people from underserved communities from entering the field of nursing. Now we are going to have a discussion and share strategies about what can be done to reduce financial barriers in nursing. Before reaching out to each of our panelists, I want to share with you some of the federal government's programs that can help you enter and remain in nursing education programs. To those of you who are listening to this forum and who are committed to diversity and inclusion in nursing, we can work together to improve these programs to ensure that there is more expansive reach and opportunity. Here are some examples of federal government programs and the type of action that is needed. First, we can substantially increase federal funding for nursing education with priority for education of nurses from historically marginalized community. This could take the form of targeted increased funding for Title VIII nurse education funding. Second, we should find support for increased funding for the existing Title VIII Nursing Workforce Diversity Program. The Nursing Workforce Diversity Program increases opportunities for individuals from disadvantaged backgrounds, including racial and ethnic minorities who are underrepresented around registered nurses. The opportunities provided include student scholarships or stipends, pre-entry preparation, and retention activities. And finally, targeted opportunity funding for the National Core or National Health Service Corps scholarship and loan repayment programs to enable health professional shortage areas and medically underserved areas to increase the diversity of their nursing workforce to better match populations served in these areas. People who are supported by these programs are required to work in underserved communities for several years. In turn, the programs pay off the nurses' student loans. There are other policy options we can and should explore that schools of nursing could use to recruit and retain more faculty who represent the historically underserved and underrepresented communities. If you're interested in working with the CCNA folks who are responsible for advocacy, please note that in the chat box, or please email winquinn at wquinn@aarp.org. And now I'm ready to turn to our panelists. To start us off, Philip Weinberg, a thought leader, will describe how his program supports underserved communities. Then we will turn to two nurse thought leaders and entrepreneurs who will describe their experiences and how their respective programs help nurses of color succeed. Welcome all. We're so glad to have you with us. So Philip, we're going to start with you. Can you tell us about Strive International and what you have found in terms of the healthcare sector being a promising sector for underserved communities achieving financial security? We'd be interested to find out how your organization creates the connections for your target communities, what technical assistance you provide to your clients in the sectors you serve, and how we can create alternative pathways into nursing.
Thank you, Tony, and thank you, Melissa and AARP Thought Leadership for inviting me to join you today. I'd like to use my time today to shine a light on ways that non-traditional pathways into healthcare careers can advance racial justice and equity, which is an especially timely and relevant conversation given the level of attention nationally in addressing longstanding inequities. Allow me to start by providing some brief context on Strive. We're a community-based, nonprofit workforce development agency that's been at this for more than 3 decades, based in East Harlem, New York, and with operations in 12 cities across the country. Each year, we help thousands of low-income individuals, mostly Black and brown, prepare for and access good careers. We do this through an intensive and evidence-based training model that's prepared over 80,000 individuals for employment over our 36-year history. And because our focus is on economic mobility and equity, we look specifically for careers for our students that meet certain conditions. They can't exclude individuals without an associate's or bachelor's degree. They must have good wages and advancement potential, and they need to be obtainable with short-term training and credentialing that typically lasts 3 months or less. We are truly an on-ramp for men and women who are searching for a better future and don't have the means or the access to get there through traditional schools, networks, and pathways. And I should note that all of our training is provided to our students free of cost for them. We also know that many of the individuals who come to Strive face steep barriers in their lives that, if left unattended, will prevent them from successfully securing and retaining good jobs. So Strive provides coaching to each student to help address these barriers, which can include help with childcare and support in finding stable housing. We also provide clothing and transportation assistance so our students can make it to our training classes and eventually to the worksite. To support their long-term financial resilience, we offer education and coaching to build positive financial habits, address debt, and build credit. In short, we deal with the whole person and ensure that we're helping our students address all of the issues that could possibly stand in their way to work. That is our promise, and we make it for life. So why healthcare, and how do we engage with healthcare employers? We find at Strive that entry-level, non-clinical healthcare positions are excellent gateways into stable healthcare careers. We have an employment team that does nothing but work with hospitals and clinics to understand their hiring needs and to construct training programs that meet the needs of what our employer partners require for specific positions. At our flagship Strive site in New York City, for example, this has led to strong partnerships with hospital systems like Mount Sinai Health System, New York Presbyterian, Northwell Health, along with urgent care centers and neighborhood clinics, and also with the Healthcare Union 1199. We train for positions in healthcare support services for initial jobs such as patient transporter, dietary aide, and nutrition assistant, and for administrative positions such as patient care coordinator, patient navigator, and patient registrar, along with positions in medical billing and coding. All of our students receive training in professional skills such as teamwork and managing conflict with a supervisor, along with occupational credentials such as electronic health records and Microsoft Office. Essentially, whichever credentials our employer partners tell us are vital for job success. In our healthcare training, 80% of our students are women, many are mothers, and there's an average age of 31. Nearly 100% are people of color. 90% of those who start will complete our training, and we successfully place more than 70% of our graduates into employment. But the real goal is not just about getting someone that first job, it's about creating a pathway for career advancement and ensuring we're helping individuals pursue careers that can lift them and their families permanently out of poverty and into financial security. This is why I'm especially gratified to be here with you today. We ought to seize this moment as a country with so much attention on equity and justice and be adventurous about how we forge new partnerships and build new pathways into good careers, especially for underrepresented candidates of color. So here's the call to action. We ought to look at how nursing programs can partner with workforce organizations like Strive, who have access to talented and motivated individuals who, following some initial work experience, would make exceptional candidates for your schools and ultimately for these nursing positions. In fact, there are inspiring examples of Strive graduates who have taken just this path and gone on to nursing careers. So in concluding, I'd offer that creating new and alternative pathways to these great roles in healthcare is an endeavor worthy of our collective attention. It turns out to be one of those rare win-wins in life. It's good for employers, it's good for our communities, and it helps to build a more just and inclusive society. Thank you for having me here today.
Thank you, Philip. It sounds like the CCNA team will want to follow up with you to see how we can work together. Let's now turn to Lena Gould. I've been fortunate to know and witness Lena in action for many years, and I'm so inspired. For those of you who do not follow Lena on Twitter, we highly encourage you to do so. Her messages are inspirational. Lena, can you share with us your amazing story and your path into nursing, and then describe your mentoring program and the successes you and your students have achieved? I'm particularly interested in the lessons we can take away from your experiences and your mentoring program.
Thank you, Tony. I certainly appreciate the question that you asked of me, especially being a CRNA. The way my story begins is pretty amazing, from where I was back then to where I am now. And to start from, I'll be honest with you, in undergrad, it was very difficult for me. I was a single mother on welfare. I was homeless. I had just 3 months before I enrolled in an undergraduate school where I actually found subsidized housing. And it was very difficult for my son and I to live off $114 worth of food stamps and $273 a month of assistance. So that was very difficult. And when I say about the difficult climb to even get into nursing, because at Fairleigh Dickinson University, they did offer nursing, but I could not even apply to the program because I knew at that time, because I was so dependent on public transportation, I wasn't able to go to the different clinical sites that was offered to nursing students in different counties. So I instead majored in accounting, and I graduated, went to New York City, worked at Ernst & Young on Park Avenue. And after a year, after I got married too, I decided not to pursue going into corporate America. Instead, I always wanted to become a nurse, so I went back to school. But I went the non-traditional route, and the non-traditional route for me was going back to school for my associate in my associate degree in nursing instead of the BSN, because I already had a bachelor's in another discipline. So from that time, when I had my first position, I was a OR nurse, and that's how I was introduced to nurse anesthesia. It certainly wasn't because I was in nursing school and I heard about it, because I don't remember and I don't recall any of the faculty who even mentioned that as something that I can go into. So as an OR nurse, from there, I worked a couple of years, but I knew I had to get out of the OR in order to get the critical care experience before going to a nurse anesthesia program. So I went from the OR to the telemetry floor, then to trauma. And at that time, I applied to the program. But it was at that time when I applied to the program that I knew that it was even going to be a little bit more of a difficult climb just getting into nurse anesthesia, you see, because my GRE scores were not at the standard that they want for me to be admitted to the program. Everything else I had great written letters of reference. I had great work experience and all of that, but I just did not do well on the GRE exam. So I received a conditional letter of acceptance. And what that did was I had to include in that letter, I had to take at least 6 credits and get a B in it in order to get a full acceptance into the nurse anesthesia program. So what I did was, for a full year, right before I enrolled, I actually took 15 credits and of all my prerequisites, and got A's in all of them, did very well in the nurse anesthesia program, and still was able to graduate with exemplary grades, and also get inducted into Sigma Theta Tau and pass the boards at the first attempt. So what really did that GRE exam measure? I mean, I just still, to this day, I don't know. But while I was in the nurse anesthesia program, and why I'm here today, is because when I was in Philadelphia, they had what they called a shared curriculum. So it was LaSalle University, Penn, Villanova, Drexel University. So we would go to different programs where the faculty would teach us the anesthesia content. At the time, this is 2002. They no longer do this anymore. And what I found was that all of the faculty in that area of Philadelphia were all white. all of the cohorts, because we were in the large classrooms with other nurse anesthesia programs, there were only a few nurse anesthesia students of color in each cohort. And also, I witnessed a student of color that did not do well in the program. And at that time, the program director asked us to do a poster project, and that's what I did. And they said, do anything related to anesthesia. And what I wanted to do was just find out more about the racial and ethnic composition of nurse anesthesia. So I did the poster project, did very well on it, but there was something that was bothering me. And what I did was, right after one of the courses, it was Dr. Arthur Swirling. At the time, he was the program director at University of Penn. I walked up to him and I told him about my poster project and told him that, something just didn't seem right. And he told me to go to a nurse anesthesia conference, and I did that. And he said, I didn't know a soul. And he said, I want you to do what no one else is doing. And at that time, I didn't know what that meant. All I knew was that I wanted to do something about it. But at that meeting on that first day, I ended up meeting Goldie Bragman, who was a pioneer, first and only Black CRNA, who was the AANA president. And I ended up meeting her, formed a long-term mentoring relationship with her at that point. But when I left there, I knew what my purpose was. And I knew my purpose was, as a professional CRNA, I needed to do something about diversifying the profession. So what I did was, at that point, my intentions was just to mentor nurses of color to go into nurse anesthesia in the next couple of cohorts. But for some reason, there was no social media at the time. It was all word of mouth. Next, nurses of color from Philadelphia area, New York, and DC found out about me, and I was just giving out information about what they needed to do and actually to prepare to go into nurse anesthesia and be very, very successful. So after that, I asked the program director at Villanova University if I can have a bigger space and can I use that? And she said yes. So what we did was, again, nurses would come and it was just all professional CRNAs. There was no one from the AANA that I invited at the time. And we would just talk to them about the admission process, the rigors of the program, clinical expectations. We talked to them about balancing family and finances and all of that. So we did that. So the next thing you know, I started to have more of those sessions. And then separately, I would have something at the hospital where I worked at on a Sunday. Nurses would come in and I would have volunteer CRNAs and we would go into the OR and we would just go over the anesthesia equipment. And then I started to realize that I was onto something and I needed to start this as a nonprofit organization. So I did that to make it more formalized. And next thing you know, it went from a regional effort to a more national effort, where at this time, what I recognize that I have to do, and it's a workforce disparity. In nurse anesthesia, it's a workforce disparity problem. So I know I had to extend it where now it's a pipeline issue or a pipeline initiative that we deal with. The first one being that we go to the HBCU schools of nursing, we go to the Hispanic Serving Institution schools of nursing. When I say we, myself and other CRNAs, we would plan to go. This is all pre-COVID, of course, where we went to the campus on that day to speak to nursing students. Many of them, too, were first generation, and we would talk to them about going into anesthesia, and we would have a one-day simulation lab with them as well, too. So at least we would set them up so that they can be successful, so they knew the next steps, what they needed to do, instead of navigating this on their own. So that's one initiative that we do. But the bulk of what we do is we have information sessions for nurses of color that are interested in going into nurse anesthesia, and usually at those events, and they're all weekend events. Either pre-COVID was face-to-face. Now we do Zoom online content where I invite 4 program directors that will make a presentation about the program. We'll have CRNAs that of color that will do presentations about anesthesia, and we'll also have a panel of nurse anesthesia students from different nurse anesthesia programs, and they're from different, not just different programs, but some of them are single, some of them are married, have children, some of them are single and have children. So we needed to have that discussion before anyone moves forward. And with that, basically what they'll do is after that point, after they have that session, when they're ready to apply to a nurse anesthesia program, then we'll set them up for either a mock interview or we'll introduce them to somebody that's a graduate of that program or someone that's currently enrolled in that program. So it's very important that their network has increased. So as a result of all of this effort that went into 16 years, basically what we do now is we follow them, we encourage them after they graduate. Many of them have since worked in operating rooms. Some of them have become chief CRNAs. Some of them have become clinical coordinators. But as a result, 577 nurses of color were able to successfully be accepted, matriculate, and graduate from nurse anesthesia programs. That doesn't even include the ones that are currently enrolled now. And I'm very proud of that fact. I'm also proud of the fact that many of them now are becoming chief CRNAs and clinical coordinators and military CRNAs, and some have even gone through PhD programs as well. So I'm very, very happy about that. But the thing is that what's most concerning still to this day is the workforce disparity when it comes to the faculty. And when I say that, just to give you the acuity of the problem, in just the Northeast area of the country, in Pennsylvania, New York, New Jersey, Rhode Island, Connecticut, and Maine, there's only one full-time faculty member who's a Black faculty member in all of those states, and that's at University of Penn, and that's it. So we have a lot of work to do when it comes to diversifying the nurse anesthesia workforce. Is very important, especially because of this year with COVID and how it impacted communities of color. We need to have nurse anesthetists of color that are out here giving anesthesia to patients that look just like them. We need to have nurse anesthetists of color to take care of patients that, with the severe problem that we have in Black maternal mortality, and here we are giving anesthesia to them. We should be the leaders in addressing that issue, and we're just not. We're just woefully ill-prepared at this time. But it's very important that the nurse anesthesia profession realize this. It's great that they embrace it, but it's time for funding to make sure that these initiatives are set in place, so that seeds are being planted to actually invest in nurse anesthesia. So with that said, like I said, I've done a lot. And I know I have in personally making a commitment to go into to diversify the nurse anesthesia profession, but I can't do this by myself. And I do believe that it's going to take a lot of effort with the nurse anesthesia program directors, with the deans, to make intentional hirings of nurse anesthetists of color to even teach in front of the class. So it's not important to just get diversity in that cohort, but also diversity in front of that class as well. So, like I said, there's a lot of work to do, but I am very, very happy with the results so far. And I look forward to partnering and working with other institutions to make this happen.
Thank you so much, Lena. We are so grateful you were able to join us today and for all that you do. We at the campaign will continue to champion you and your work. Now we would like to bring another friend of the campaign, Charmaine Lawson. Charmaine, similar to Lena, can you please share your story with us, your entrepreneurial work, and lessons that we can incorporate into achieving health equity through more diversity and inclusion in nursing? And we'd love to hear about mentoring, how those can support nursing assistants and/or LPNs into and through RN and BSN programs.
Thank you, Tony. Thank you for having me here. First, I'd like to say that my journey as an entrepreneur has not been easy. Many of you know my story, and several of you don't know my story, but it started as a little girl who was adopted by her paternal grandmother, and we were living in the housing projects here in New Orleans, Louisiana. And I don't know, I need to just be honest and say, I didn't always want to be a nurse. I initially wanted to be a musician and then later on fell in love with nursing when I took a science class in elementary school. And that's when my first mentor was realized, and I was able to really at an early age see the power and importance of a mentor. And I know we're talking a lot about mentorship in later stages of when people are trying to decide on nursing, but I'd like to say that mentorship starts a little earlier. And for me, that was in the fifth grade with my fifth grade teacher. And she taught me pretty much everything I needed to know about science and just fostered the love and put that early seed and germ in me of wanting to pursue nursing. So when I got to high school, it was pretty much I think I want to do nursing. And so I was fortunate to be in a high school program, whereas high school juniors and seniors could get a small glimpse of what it was like to be in nursing by becoming a CNA, certified nursing assistant. There I met my second mentor, and she was amazing. She was a registered nurse, and she just walked me through the whole process of what it was like to be, one, a CNA, a certified nursing assistant, and two, to also encourage me to become later an RN. And I would say that she was very, very instrumental in doing this. So mentors are really, really valuable in that they inspire, but also they provide safe places for anyone who's looking to go into the nursing profession. So I have my mentors to thank for that. And it's because of that early leadership from them, I was able to move forward and go into other things like entrepreneurship. So I get all excited and my eyes are getting wide because I get excited about now my whole NOLA the Nurse series, which is about inspiring the next generation of nurse practitioners. And just like I was inspired at a very young age in fifth grade, I began writing books about a little girl, Nola the nurse, who wants to be a nurse practitioner like her mom. And I created the story specifically to help foster just little children to want to get into nursing, not just specifically to become an RN, but to become an advanced practice nurse. And I wanted to inspire them and also foster cultural sensitivity because each story explores another culture and also teaches children about the roles that advanced practice nurses play. I felt it was really important to reach children at a younger age. The books are geared towards children who are fourth through sixth grade. And I felt like, let's get these babies talking about nurse practitioners. Can they pronounce nurse practitioner? Can they pronounce certified registered nurse anesthetist? Can they say these terms? We need to start generating the buzz, and I believe that starts at an early age. So that's one of my passions. And just to talk about another entrepreneurial passion is my house call course. I was the first nurse practitioner in the state of Louisiana to start a house call, a medical house call practice shortly before Hurricane Katrina, and thereafter, we were able to serve hundreds of thousands of patients who would otherwise not receive health care. And that just inspired me to say, you know what, I've got to make some clones. I've got to make some clones of me because there's so many people who are in underserved areas. And I always felt like if I'm going to make some clones, I need to start them at an early age, which is when I first started getting the desire and early, I'd say, bug or germ with entering the nursing profession.
Thank you all for your research, your programs, your stories, your passion, and for the lessons we can take and incorporate to continue to build more diversity and inclusivity in nursing. To those of you that are here today, I want to add that financial barriers can seem unsurmountable. The best advice I ever received and that I share is to worry about getting into school. Once you do, the money will follow. I aimed high, not always sure of how things would end up, but they did. So what I'm asking is, don't say no to yourself or nursing before you even start your journey. Best of luck to all of you, and I look forward to working with you individually and collectively to increase the diversity in nursing. Now, at this point, I'm going to ask the Campaign for Action's Director, the Robert Wood Johnson Senior Advisor for Nursing, and the National Academy of Medicine Senior Scholar in Residence and Senior Advisor to the President on Nursing, Dr. Susan Hassmiller, to share some parting thoughts. Sue?
Thank you, Tony, and thank you for your leadership and service you provide to the Campaign for Action. I have a feeling we'll be hearing from you with more strategic ideas of what CCNA can do to achieve health equity through diversity and inclusion in nursing. Wow, and wow, and wow again. We have a long way to go to have a more equitable healthcare system, and to do so, we need everyone here today and so many other organizations to commit to helping to diversify the nursing workforce to achieve health equity. It is so important that we more fully examine and explore this intersection of financial well-being, health equity, and diversity and inclusion in nursing. I'm Sue Hassmiller, and on behalf of the Robert Wood Johnson Foundation and the Future of Nursing Campaign for Action, I thank you for being with us today. Racism and injustice have no place in our country today. The historic times in which we find ourselves today more than ever illuminate the inequities. And we also see that the unique role nurses can play in helping achieve health equity. Now more than ever, there's an urgent need to address barriers to health equity and create better systems, systems in which all people have an opportunity to live as healthy and as well as possible. 2020 provided us with enormous challenges and unique opportunities where nurses can and do show up as leaders, especially in policies that address social determinants of health, inequities, and the nation's overall well-being. As today's program underscored, having a more diverse nursing workforce, among other actions, will help us achieve this very important goal. One of the hats that I wear, as was mentioned, gives me the privilege of working with the National Academy of Medicine Committee on the Future of Nursing 2020-2030 report. Let me give you an update on its status and plant some seeds with you about what we have planned leading up to and following the release of the report. As background, on July 30th, the National Academy of Medicine announced a delay in the release of its second Future of Nursing report to the spring of 2021. The shift in the report timing came after the NAM updated the publication's statement of task to consider newly emerging evidence related to the COVID-19 global pandemic and include recommendations regarding the role of nurses in responding to this crisis. Initially planned for the release in December of 2020, the Future of Nursing 2020-2030, supported by the Robert Wood Johnson Foundation, has now been expanded to include the dramatically changed context and rapidly deployed changes in clinical care, nurse education, nursing leadership, and nursing community partnerships as a result of the pandemic. This content is in addition to the anticipated report recommendations that chart a path for the nursing profession to give everyone a fair and just opportunity for health, reduce health inequities, and improve the health and well-being of the United States population in the 21st century. The report is in revision now, and we anticipate its release will occur early May of this year, hopefully Nurses Week. To that end, the campaign has planned a number of virtual events that I hope you will attend. You are all cordially invited, so please mark your calendars now. In 3 weeks, on February 24th from 2 to 5 p.m. Eastern Time, we'll host The Future of Nursing, Passion, Progress, and Purpose, so we can honor the sacrifices and contributions made by nurses, reaffirm the critical importance and power of nurses at this time, build momentum and anticipation for the National Academy of Medicine's release of the Future of Nursing 2020-2030 Consensus Study, a blueprint for the largest group of health professionals, nurses. Recognize and acknowledge all stakeholders of the Future of Nursing Campaign for Action's progress since the 2010 release of the first report, The Future of Nursing, Advancing Change, Leading Health, and to anticipate this next report. Then in March, our third Health Equity Action Forum entitled Individuals, Family, and Community will occur from 11 a.m. to 1:30 p.m. Eastern Time on Tuesday, March 30th. During this event, we will celebrate Women's History Month with the intersection of diversity and inclusion, and we'll hear about several nurses of color who shaped the profession, including Mary Seacole, Sojourner Truth, and Harriet Tubman. We will also discuss the Campaign for Action's Health Equity Toolkit and how nurses are using to support historically underserved communities. As noted above, in early May, we will meet you again when the NAM releases its Future of Nursing 2020-2030 Consensus Study. The campaign will host a set of virtual conversations with key stakeholders to educate, engage, and activate stakeholder interest in promoting a culture of health, well-being, and health equity, and importantly, to encourage stakeholders to discuss and explore the new report. And here's the virtual drum roll. Brrr, please, last but certainly not least, we'll culminate the Health Equity Action Forums and the new NAM report convenings with a major stakeholder event occurring on June 3rd and June 4th. At this virtual meeting, all of us working together will chart the path forward to implement recommendations from the Future of Nursing 2020-2030 Consensus Study with our key stakeholders. Again, all of these meetings are open to the public, and we hope to join others who will attend, including our action coalitions, campaign leadership, and committees, nurses who work in every practice setting, supporters, nurse champions, policymakers, and health equity and social justice stakeholders, just to name a few. As you can hear, the audiences for these convenings are deep and wide. The time is now for nurses to be more directly working with as many sectors of critical stakeholders as possible. We encourage you to visit our website at campaignforaction.org, as the campaign will continue to provide updates about the Future of Nursing 2020-2030 report as more information becomes available. And if you missed the engagement webinar, you can read about that important event as well on the campaign's website post titled Advancing Health Equity in the Era of COVID-19. If you want to be involved with us in our overall health equity and diversity efforts, you can reach out to Jasmine Cooper at jncooper@aarp.org. If you would like to be involved in the advocacy work related to health equity, please reach out to Dr. Winifred Quinn, or Wynn, WKUINN at AARP.org. On behalf of Susan Reinhart and me, I want to thank our MC of the day, Dr. Piri Ackerman-Barger, and the team who organized this, Scott Tanaka, Anna Hervada, Jasmine Cooper, Melissa Grober-Morrow, Aidan McCallan, Yvette Pena, Wynn Quinn Piri, Doctors Adriana Perez, Lisa Martin, Regina Eddy, and our favorite honorary doctor, Barbara Nichols, Claudio Gualtieri, and Peter Reinecke. On behalf of the RWJF, I also want to extend my sincerest gratitude to our sponsors for today's forum, AARP's Thought Leadership Team and their Senior Vice President, Dr. Jean Asias, as well as AARP's Multicultural Leadership and the team's Senior Vice President, Ms. Edna Kane Williams. We're always pleased and honored to work with you, and especially now during Black History Month, when we are reminded of bringing forth the wisdom and thought leadership of our Black and African American colleagues, and to champion these nurses and all other nurses from underrepresented communities. Thank you, all of you again, and we look forward to seeing you again on February 24th. Until then, stay safe and stay well.